So it's very important, I think that traditional pathology should still be there in the future, but should be integrated with next generation sequencing and all the technologies that we will be using in the next year. This is very important because we should not, basically replace what we have done in the past by new technology. Technology is very important, but should be put in the workflow that we use in order to diagnose and care cancer patients. Let me just get an example of a breast cancer patient. We still characterize breast cancer patient by using a couple of immunohistochemical biomarkers, and we are doing a very good job in doing that. But nowadays it is very important to characterize these patients not only by using immunohistochemistry, but adding up other techniques like, for example, multi-gene analysis or BRCA testing. This is very useful in order to better characterize our patient and better care our patient as well.